welcome back to this class. So, next 2 to 3 class, what I will try to do is summarize the glucose sensing in terms of all the technologies we have studied so far and few other newer stuff. So, one of the key challenge of teaching biosensors for any kind of situation, for viral detection, for bacterial detection, for biomolecule detection, toxin detection, is lot of them are under IP protection, and not a whole lot of literature are available in the open source. And during last 50 years, most of the biosensors which have been developed for diagnostics, biosecurity, so toxin detections are all based on the first sensor, which is the Clark sensor, followed by the glucose sensor. And it is the modification of that model which ruled the landscape of biosensor design and manufacturing. And if we really put them in context, then we will observe that prior to non-enzymatic progress, it all remain in the enzymatic side of development. So, today what we will try to do is we will devote few classes to summarize the readily available technology to the far reaching technology which are still under development, and in that process all of you will have a clear idea that how much can be done, how much opportunities are there, and above all a clear picture about understanding the basic mechanisms of different optical, non-optical, magnetic, thermal, spectroscopic technologies, so as to develop next generation of biosensors. Apart from it, through this process, one more realization will come through, how miniaturization of these kind of devices are shaping the future of biosensor development. Another aspect is the growing popularity of non-invasive techniques, because most of the time we are talking about body fluid. As long as it is something like urine, sweat, it is fine, but then when we talk about drawing blood, things become little bit more complex, because drawing blood means you are puncturing the tissue. So, you need a sterile needle, you need to draw the blood properly, then of course, all the detection challenges in terms of interfering molecule, the physiological status of the person, so on and so forth. So, here let us start with a little bit of a recap how the glucose sensor started, and then we will move on to the known ones, and then we will move on to the far reaching ones. In that process, we will cover the almost the complete spectrum of biosensors which are being explored across the world. So, to start off with, the title as it says, summarizing the glucose sensing, and the first thing we will discuss is the situation of diabetes. We have already talked about the diabetes as a disease that result from abnormal level of insulin to the body due to either the malfunction of the pancreas not producing enough insulin, or the cells in the body not using it adequately. Insulin is a hormone, as we have already discussed, that regulates the level of glucose by allowing cells to absorb it from bloodstream to obtain energy or store it for future use. However, if the level of glucose in the blood remains very low, very high for a long period of time, it could cause hypoglycemia or hyperglycemia respectively, leading to severe medical conditions. As I have already mentioned, it changes the blood flow parameters because of the number of particles. If it increases, it slows down, the number of particles decreases, it falls down, including tissue damage, stroke, kidney failure, blindness and heart disease among others, and finally death if left untreated. Deficient production of insulin in the pancreas leads to diabetes type 1. This is a new set of information characterized by sudden drop of glucose level. On the other hand, ineffective use of insulin leads to diabetes 2, which is characterized by high level of glucose. Both conditions do not have a cure, meaning that regular glucose monitoring in diabetic people is necessary for rest of their life. And this is the key point of the whole link of glucose sensing, diabetes and insulin, and of course, type 1 and type 2 diabetes. And if we look at it, unfortunately, the tissue of regularly checking blood glucose for most diabetic people is not very pleasant. Now comes the conventional devices for glucose monitoring use the electrochemical method, which requires a small amount of blood to be drawn out of the body by either finger pricking or a thin lanceolate implanted subcutaneously. If you remember the tattoo, this is the situation, and this I have already talked about the fingerprinting situation. The difference between both is that the first only provides a snapshot of glucose level at one time point, whereas it does not require professional assistance. So, it is called self monitoring blood glucose system, self monitoring blood glucose system. So, this is one of the system. The second one provides continuous monitoring. So, the classification could be done based on continuous monitoring versus a snapshot monitoring. So, one single time point. Okay. Now, thus it is called continuous glucose monitoring device, CGM. The other one is continuous glucose monitoring system. So, this is the other classification. One is SMBG, which is self monitoring. You can do it all by yourself, blood glucose level, and other one is continuous glucose monitoring, and thus it is called continuous glucose monitoring device. However, both of them not only cause discomfort, pain after repeated use, but also pose risk of potential infection. This is extremely important. When I was mentioning you that you need sterile needle or for a pricking device, or you have an implanted tattoo, something like, if you could see it. So, there is an implanted tattoo. So, such things could cause series of infections, because these are active devices. It is not a regular tattoo, which is just a dye. It is something else. There is a device there, there are a set of electrodes there, there is a transponder there, there is a whole range of complex instrumentation which are implanted, okay, resulting in poor patient compliance for daily assigned measurement. Consequently, since the end of the last century, there has been a continuous effort for developing non-invasive devices, NI devices, no need for bloodletting, minimally invasive, aimed at reducing some of the issues connected with traditional invasive methods. So, you see, either it is an invasive method or a non-invasive method. Invasive, non-invasive, this is one way of classification. Other one is SMBG versus CGM, continuous glucose monitoring. So, these are some of the ways you can classify them. And why non-invasive? The development of genuinely non-invasive devices, NI devices, for glucose measurement would represent a life-changing factor for millions of patients around the world, allowing them to monitor their glucose level confidently and receiving quick treatment if necessary. It is also represent a vast potential market. According to WHO or World Health Organization, currently there are around 450 million cases of diabetes in the world, and the number could potentially reach to 700 million by 2045, with an increase in 39.7 million by 2030 and 60.6 million by 2060 in the United States alone. So, you are realizing this number tells why this non-invasive monitoring is going to get tremendous popularity, because this is where the future lies. Okay. Now, if we look at the laboratory methods, what we have discussed, some of them: enzymatic amperometric method and hexokinase method. Hexokinase I haven't discussed, whereas enzymatic amperometric method I have already discussed, but I will briefly go through it. And some of the equipments which are in the market for your general knowledge, these are those equipment: YSI 2700, YSI, this is from the same company, Biosense C, line S. Then you have the Beckman Coulter, this is hexokinase, Abbott Architect from the Abbott Labs, Hitachi and Cobus, and intended use laboratory point of care, laboratory, this is for the laboratory point of care. So, this is how you have to classify. And if you look at the samples, blood, plasma, these are all invasive, serum or cerebrospinal fluid, blood, plasma, serum, urine, cerebrospinal fluid, except urine, which body is excreting out. So, you can work, and this is the range we are talking about of all these different kind of devices, milligram per deciliter. Okay. So, this is just for your general knowledge about the kind of instruments what we have. Now, this is the one what we have discussed, enzymatic amperometric method. Why it is enzymatic? Because there is an enzyme involved in it, glucose oxidase, which is converting glucose to gluconic acid, and in that process the other substrate, oxygen, is getting reduced to peroxide, and then peroxide on top of an electrode on anode is being oxidized back. There is a oxidation reduction happening here, by which it is giving away the 2 protons and 2 electrons, and these electrons are being measured amperometrically. So, considering that the enzyme glucose oxidase is specific to glucose, in this method the oxidation of glucose takes place in the presence of glucose oxidase and oxygen and water to form gluconic acid and hydrogen peroxide. The hydrogen peroxide is then electrochemically oxidized. This is the process which is happening here at the anode of the electrochemical probe, producing amperometric signal or a current proportional to the concentration of glucose in the sample. And the very early ones, the very first one, utilize how much oxygen is being consumed in order to figure out how much glucose is present in the sample. This was the very early one, just using the Clark's electrode of oxygen detection. Okay. Now, in terms of the glucose oxidase method, a popular glucose analyzer using such technology is blood glucose analyzer, which contains a solution of glucose oxidase between the gas permeable membrane of oxygen electrode and an outer semi-permeable membrane. Through diffusion, the glucose crosses the semi-permeable membrane and react with glucose oxidase. Once the hydrogen peroxide is oxidized, the reaction consumes the oxygen near the surface of the oxygen electrode. Then the consumption rate is measured. The loss of electron and the rate of decrease in PO2 is directly proportional to the concentration of glucose in the sample. So, this is the most simple way to tell the basic principle of this process. This is how it works. Now, the next method is which I haven't discussed so far, is called hexokinase method. This is another popular method, hexokinase. So, what is happening is that glucose in the presence of hexokinase, which is an enzyme, this is again an enzymatic method. What it does, it converts ATP to ADP, and this from 6 glucose phosphate. This 6 glucose phosphate again in the presence of hexokinase and in the presence of NAD converts NAD, it reduces the NAD to NADH, and when it reduces the NAD to NADH, you see a signature for appearance of NADH. So, the concentration of NADH which is generated in this whole process of how much will be the glucose is directly this glucose and NADH proportion are proportional. So, if more is the glucose, more will be the NADH, and this intense will be the signal. So, hexokinase method, also known as photometric method, consists of a series of chemical reaction as shown in figure. In the first stage, the glucose react with enzyme hexokinase in the presence of ATP, adenosine triphosphate, which is the energy molecule, and magnesium ion. So, this is what is you just have to add. So, why you have to add all these things is realize when you are developing a sensor, you have to understand the native conditions under which this reaction is occurring. If you do not understand this, your sensor design will be flawed. So, you have to have the presence of hexokinase plus magnesium, because in the presence of magnesium this operation happens with maximum efficiency. So, produced glucose 6 phosphate, what you see here, glucose 6 phosphate and adenosine diphosphate ADP. In the second stage, 6 glucose phosphate and nicotinamide adenine dinucleotide, which is NAD. Nicotinamide adenine dinucleotide go through oxidation with glucose 6 phosphate dehydrogenase until being reduced to 6 phosphogluconate and nicotinamide adenine dinucleotide in a reduced state NAD to NADH. The amount of NADH is proportional to the amount of glucose in the sample, and it has the property of absorbing light at 340 nanometer. This is the critical point. The amount of absorption is proportional to the amount of NADH, meaning that glucose can be measured using standard spectrophotometric technique. So, this is the other very popular method, hexokinase method, which is now an addition in your repertoire of technologies which have been used for glucose monitoring. So, comparison between laboratory and self monitoring techniques. We talk about self monitoring glucose level. Laboratories are exceptionally good, sensitivity is exceptionally good, measurement time is slightly longer, trained laboratory manual is needed, sample type is blood, plasma, serum, urine, and blood extraction method, it is invasive. On the other hand, when we talk about self monitoring one, which will be coming soon, they are good, they are not very good, again good, they are quick. This is where the catch is, measurement time. They do not need any laboratory personnel, so it is very personalized. You can use blood and ISF, interstitial fluid, and it is an invasive. So, all of them are invasive method. Now, if we look at the basic of how these self monitoring blood glucose level are working. So, this is how they work. SMBG devices are typical glucometer requiring finger pricking. This is where you are drawing the blood with a lancet and access the capillary blood. The glucose measurement method is then fundamentally the same electrochemical technique previously described. The main difference, however, is the complete reaction and the detection takes place in a glucose test strip connected to a meter. After putting a drop of blood sample on the test strip, the glucose oxidizes in the presence of an enzyme to produce a certain amount of current proportional to the glucose level. The electron then travel to the meter containing a current to voltage converter to provide a voltage proportional to the level of glucose. So, now if you look at the device, this is how the device looks like. This is where current to voltage conversion is happening. This is where the real calculation is happening. This is the test strip, glucose test strip. This is the counter electrode. This is the working electrode coated with an enzyme. So, here you have the enzyme in red, okay, and here is the reference electrode. So, this is, practically speaking, it is a 3 electrode configuration. Remember this, because we will be coming back to this. What is this 3 electrode configuration? This 3 electrode configuration is primarily used in most of the electrochemical sensors, but now glucose sensors has moved to 2 electrode configuration. So, I will get back to this in the next class. We will start with the 3 electrode configuration briefly, then we will move on to the next set of sensors. Thank you.